This was no ordinary 911 run. A swarm of emergency personnel, hazmat suits, specialized equipment, and an isolation tent inside an ambulance. The primary concern today is that Dallas Sheriff's Deputy Michael Monig came to the clinic complaining of some Ebola-like symptoms. Some, but not all, says the Frisco Fire Chief.
I would indicate that this patient was not experiencing all of those symptoms, just a few. But again, based upon screening criteria from the CDC, the treatment tends to be based a little bit more conservative at first.
But of course, Monig was not just any ill patient. He was one of the deputies who entered Duncan's apartment and dealt with the family there. Though Duncan, the only affected person, was already at the hospital at the time. It will take 48 hours to confirm if Monig has Ebola. We interviewed his son today, who is optimistic about his father's prognosis.
Don't worry, he's going to be okay. And again, on the 0.01% chance this is Ebola, I think our odds are pretty good.
The chief says they are still figuring out how to decontaminate the department's people and its gear.
We have calls in to the Center for Disease Control. We also are working with our public health officials here in Denton County. We're going to get their recommendations on the proper decontamination procedures of the ambulance.